Hi, my name is Eric Messamore, and I'm a psychiatric physician with a practice focused on second opinions and consultation. I work with a lot of people with depression, and many of them use cannabis, so the question often comes up about whether cannabis is useful in the treatment of depression, and that's the question we're going to address in this talk. Based on Google autocomplete suggestions, it seems that quite a few people are wondering if marijuana is good for depression. And it's a very logical question. Cannabis, after all, makes many people who use it feel happy and relaxed, and those drug effects would seem to be a perfect match for somebody who's experiencing depression. In fact, if you look at people who are experiencing depression, you'll find that about 20% of them are using cannabis. And if you drill down to young men with depression, it appears that 1 in 4 are using it every day. So it's a popular idea, but it will turn out, as we'll see in the next slide, it's not an original idea. It turns out the idea to try marijuana as a treatment for depression is a pretty old idea. And medical marijuana itself is not a new thing. It was used widely in medical practice from the middle of the 19th century in Europe and America until the early 20th century. And at the beginning of the Western medicine use of medical marijuana was a French psychiatrist named Jacques-Joseph Moreau, who tried it and liked it and was fascinated by it. Moreau had friends in Paris. They called themselves the Hashish Club, and they did a lot of self-experimentation. Moreau immediately realized that the happy and relaxing effects of cannabis would be a perfect match for people with depression. So he proceeded to do what was essentially the first clinical study of cannabis as a potential depression treatment. And although he started with great enthusiasm and optimism, Moreau had to concede that it really wasn't much use. He writes that a few of the patients that he gave it to were more talkative, had some brief mental status changes, but quickly reverted to their depressed states, and overall was not a successful intervention. And not a whole lot happened in the world of cannabis mood research until 1973. As everybody knows, cannabis became very popular in the late 1960s, and so the idea that it might be useful as a depression treatment once again came into being. And this time the idea landed in the minds of Joel Kotin and colleagues at the National Institutes of Health. Kotin and colleagues decided to give THC to 8 individuals with severe depression. And what they found was essentially a reprise of what Moreau had described in 1845. The investigators were able to make a few people more talkative, but it was not a lasting effect, and they went back to being depressed. And while they made some people more talkative, in 2 out of 8 cases, or 25% of the sample, they gave people severe anxiety or other adverse side effects that made it seem very not worthwhile as a depression treatment. In fact, it turns out that there has been no clinical study from 1845 to present day which shows a beneficial effect of cannabis in people who have depression. So since we can't find any clinical studies that indicate that marijuana is good for depression, let's approach the question another way and go through the medical literature and see if there are any studies which suggest that there are reasons for concern. So let's start this discussion by looking at these results from an analysis of surveys of cannabis consumers. about the kinds of side effects that they reported or experienced. So Green and colleagues back in 2003 they reviewed the literature and found several cannabis user surveys about effects and side effects of the drug, and Green simply compiled the data. On the left-hand table, we're looking at the responses that cannabis consumers gave when asked in an open-ended fashion, tell me about the side effects that you've experienced. So in response to that kind of question, between 1% and 10% of cannabis consumers volunteered the idea, it caused me to have depression. On the right table, we're looking at the frequency of side effects that cannabis consumers gave when presented with checklists. So they asked the consumer, have you ever experienced X, Y, or Z? And there are the results, and the blue highlight is for the frequency of depression reported on symptom checklists, and 27% of respondents say that cannabis had caused them to experience depression at some point. And next we have this very interesting and a bit concerning set of data that came from Kerry Cutler and colleagues at Washington State University. Here we're looking at the results of surveys of medical marijuana consumers who were tracking their symptoms in an app called StrainPrint. The StrainPrint app contained 12,000 sessions in which symptoms were recorded, and this database included more than 3,000 people with depression. So the results of this analysis showed that during periods of cannabis use, in other words, during the time the drug is in the body or during the period of intoxication, that there was reduction of depression, reduction of anxiety, reduction of tension. However, and here's the concerning part, symptoms of depression over time didn't get any better, they got worse on average. So the study is reminiscent of the findings of Moreau and of Kotin. There can be short-term relief, but not lasting benefit. And on the contrary, Cutler and colleagues' StrainPrint app database analysis suggests that over time depression worsens. So you can conclude that either cannabis is ineffective or that it contributes to a worsening of depression in people that have depression. And now we're going to look at a couple of meta-analyses that look at associations between the use of cannabis and the likelihood for a diagnosis of depression or for the presence of suicidal thinking. We're going to start with a meta-analysis by Lev Ran and colleagues published in 2014. In this study, we're analyzing 14 prior studies, which altogether involved about 76,000 people. Averaging all these findings, Lev Ran and colleagues found that amongst people who have had any history of cannabis use, that there was about 17% higher odds of a depression diagnosis being present, and that met the statistically significant cutoff criteria. When you analyze studies when you look at frequency of use, if you parse out the studies that focus on people who use cannabis weekly or more frequently than that, then the odds of a depression diagnosis increase by 62%. So higher risk of depression is associated with higher cannabis use. And here we're looking at another meta-analysis, this time by Gabi and colleagues published in 2019. And here we're focusing on the associations between use of cannabis during adolescence and the likelihood of a depression diagnosis in adulthood. And the finding of 11 studies, 23,000 people, is that adolescent use of cannabis was associated with a 37% greater risk of being diagnosed with depression as a young adult. And in this slide, we're looking at another analysis from the same paper. This time, instead of looking at the likelihood of a depression diagnosis, we're looking at the likelihood of suicidal ideation being reported or of suicide attempts being made. And here is where the more alarming findings happen. Adolescent cannabis use is associated with a 50% increase in the odds of suicidal ideation and an increase in suicide attempts that is more than 3 times the likelihood that you would see in people who have not been exposed to cannabis as an adolescent. So these data point to an association between cannabis use and depression diagnosis and suicidality. And if we look further into the medical literature, we see several clinical studies that show that people with depression who use cannabis are more likely to have bad reactions to THC and are likely to have longer courses of illness, more problematic courses of illness, and poorer responses to antidepressant treatments. So to this point, we've seen higher rates of depression amongst people who use cannabis, higher rates of suicidal thinking and suicide attempts amongst adolescents who have used cannabis. We see amongst cannabis consumers that a portion of them flat out report depression as a side effect, and we see poorer response to antidepressant treatment over time. And from the strain print database, we see, although there's a period of elevated mood associated with acute use, that over time depression gets worse. So altogether, the data are suggesting that marijuana is unhelpful and might be harmful for people with depression. And if we look at animal studies, we can begin to get a picture of neurochemical explanations for these findings. Let's first look at these results from Klein and colleagues. Here we're looking at levels of serotonin, which is a mood-boosting neurotransmitter, in the frontal cortex of rats. The frontal cortex is a brain region which has been repeatedly implicated in the development of depression. The top line in this graph is showing the effect of the antidepressant drug citalopram. Citalopram is a serotonin reuptake inhibitor. Inhibiting the reuptake of serotonin causes levels of serotonin in the brain space to rise, and that's what we're seeing going on in the top line of this graph. There's about a 4-fold increase in serotonin levels after the rat was given citalopram. The middle line on the graph is where things get interesting and concerning, because here we're seeing the effect of a drug called Win-55-212, and Win-55-212 is basically abolishing the ability of citalopram to raise serotonin levels in rat brain. Win-55-12 is a drug that turns on the CB1 cannabinoid receptor. In other words, it activates the receptor that the THC in marijuana is intended to activate. So this study shows us that turning on cannabinoid receptors in the frontal cortex has the ability or the potential to block the release of serotonin in response to antidepressant drugs. And an anti-serotonin effect of cannabis has been shown in several other animal studies, and we see this effect both in short-term exposure to THC as well as in studies that use longer-term THC exposure. So altogether, animal studies suggest the possibility that the THC in marijuana can decrease the brain's ability to produce and release serotonin in brain regions that are implicated in the development of depression. And so these animal findings may explain why we see higher rates of depression amongst cannabis consumers, why we see depression as a side effect in some cannabis consumers, and why we see poorer response to antidepressant treatment on average among people who use cannabis. So what does all this mean for somebody with depression who's thinking about using cannabis, or for somebody with depression who is using cannabis? It means that cannabis may offer short-term relief, but it doesn't appear to really promote wellness or full recovery from depression. And these data that I've shown you are very consistent with what I see in my clinical practice, where I meet quite a few people with depression who are using cannabis medicinally. It appears that they get brief short-term relief. They're maybe partially better, but not fully recovered. So, to anyone in that situation, I'd like to emphasize that a partial response to depression, or hobbling along with less severe symptoms than before, or brief reprieves in bad mood, um, I mean, they're okay goals, but they're not the goals that anybody really should settle for. Anyone with depression deserves a full recovery, and full recovery is absolutely a realistic goal with the right kind of treatment. And the right kind of treatment for at least some people might involve giving cannabis a break. Regardless of whatever treatment is being used, I encourage anyone with depression to think a little bit and find out what symptom or symptoms are getting in the way of having the kind of life that they want to live. And then once those symptoms have been identified, figure out a way to score them, like how bad they are on a day-to-day or week-to-week basis, and then write them down, either on a journal or a spreadsheet, and track them over time. Treatment for depression is supposed to relieve symptoms and ultimately get them gone. So if whatever treatment you're using is not moving your symptom score in the direction where you need it to be, then it's time to seriously rethink using that treatment or changing the treatment plan, or maybe again considering the possibility that that treatment is getting in the way of your success. And along those lines, to folks who have depression and are currently using cannabis, consider the results from Sir and colleagues, which find that people who use cannabis regularly and cut back or give it a break oftentimes report improved mood, reduced depressed mood, reduced anxious mood, and better sleep quality. It seems a little paradoxical because cannabis, again, has its reputation for relieving tension, improving mood, and promoting sleep. And it seems to be that those can be helpful effects in the very beginning, but there seems to be a subtle shift over the time, to the point that, as Sir found out, or as I hear from many of my patients, in a regular cannabis user who decides to cut back or give it a break, there can be an improvement of mood and sleep. So that's a finding, and it may be worthwhile to give it a try for some folks. So then, last slide, to just summarize, we started off with the question, is marijuana good for depression? And looking at all the data, you'd have to say, for the average person, probably not. To review, we don't have any clinical data that says that it can be useful. The data that we do have says at best it can produce short-term temporary relief in some symptoms, but that comes at the cost of getting in the way of other treatments and maybe causing depression or exacerbating depression or making it more complicated or worse over time. We've seen that up to 25% of people who use cannabis have reported depression as a side effect. And this very large study of medical marijuana users that used a strain print app to track their symptoms found again short-term reprieves, but came at the cost of worsening depression over time. So there's really no evidence to say that it helps the average person, and a good amount of evidence to say that it might get in the way. And of course, we have those animal studies that suggest the possibility that it can interfere with the production and release of serotonin in brain regions that are linked to mood. So although human beings are diverse and complicated, and depression is very diverse and complicated as well, so it certainly is possible that some people might get extremely good results from using cannabis, but a whole bunch more people would appear to get at best temporary relief, and that seems to be like a bad trade if you're not going to get complete recovery. And complete recovery is an achievable goal that people deserve. So Anybody listening, please factor those things into your thoughts about the relationship between cannabis and depression and treatment. Thanks everybody for listening. Please leave me comments. Let me know your experience and your thoughts.